Hello, everyone, and welcome. Thank you to everyone who joined today for today's webinar on measuring the patient experience with PDS Analytics. My name is Nicholas Rodriguez. I'm the National Sales Manager here at PDS, and joining me today is Scott Everett, our Vice President of Healthcare Solutions.
Thanks for joining us, everyone, today. I think a lot of times when people think of patient experience, they think of, well, we're looking at patient satisfaction scores, which that's obviously a big part of it, but patient experience really spans the entirety of the experience that they have within the practice, from the time they try to get an appointment all the way up till seeing the provider, and even to the time that they get their final bill. And we want to make sure that we're able to visualize exactly what the patients are perceiving while this process is going on.
Yep. So why is this important? If patients are having good experiences and are happy with our practice, that increases their loyalty and causes a lot more referrals to our practice. But also, programs like MIPS and other quality-based incentive programs actually utilize patient satisfaction metrics as part of their reimbursement.
Yeah, and actually, speaking to that last point there, Nick, as someone several years ago, I was with a large health system, and we underwent a massive initiative centered around improving patient satisfaction scores. And it was really interesting to see that as that progressed forward, our patient sat did go up quite a bit, but we were also never better financially. We underwent some really creative and effective patient access initiatives. And in the end, the organization became top 10 in the nation for quality. And so really you can see that when you're becoming patient focused and looking out for them, everything else really kind of falls into place. We want to talk a little bit about a recent survey that came out from Press Ganey, who obviously is one of the national leaders in patient satisfaction surveys. They put forth a consumer experience trends in healthcare report, which was a survey conducted last September. And there were some really interesting findings that came through on this. And most of it revolved around online listings and online reviews of providers. And when patients are selecting a provider, they're looking at these online reviews. A lot of them are looking at multiple reviews before they select a provider. And a number that really stuck out to me is that 84% of patients, just a huge number of patients, said that even if they were referred to another provider by their provider, they wouldn't go make an appointment with that provider if that provider had a less than a 4-star online review. And so I think that really kind of points to how critical it is that we're understanding these reviews that are out there and how we can get there. And of course, if we're looking at what's getting these 4- and 5-star reviews, 71% of the customers or patients that were surveyed said that it wasn't necessarily the outcome that they got. It wasn't the cost that they got. It was the level of customer service that they received. So we can see that really it's not just the provider that we're looking at, but the care team as a whole.
Yeah, some really interesting statistics there, Scott. And, they kind of beg the question of, where can I find out what our patients think about their experience and, interacting with our practice and physicians. And, the obvious place we're going to find most of that relevant information about how patients perceive their care and, their experience is our patient survey data. So at this point, we're going to go ahead and turn our cameras off just to maximize our screen space here. So let's take a look at some patient satisfaction data. Here at PDS, we've actually modeled that data into our PDS Empower visual analytics tool. And you can see at the top of the screen here, we have patient sat by division, care team scores, and even scores on would the patient recommend the provider. So Scott, we can interact with this report, slice and dice and, ask questions of the data. But what is this report really telling us here?
Yeah, so I think a report like this and getting it visual is really something that's great to have as an executive if you're looking at things like this, where you can come in and kind of quickly identify the outliers and apply some filters, and you can see, infectious disease is lagging a little behind the others. We can even look at the lower providers within infectious disease itself and see which of those providers are really kind of hitting those outlying spots. We can also really focus in on areas that we find are important, like care team, which we discussed before as a big loyalty issue with patients, as well as clinical access and being able to get into the provider, because that's where a lot of patients are getting their first impression, which can really drive the overall satisfaction that they have with the practice. So looking at that, we can see in these areas with those outliers that, the care team scores were pretty good. There was an outlier that probably needs to be addressed. But when we look at it, in addition to that, those access scores are really pretty low. And so we may even want to look at that and get even a little bit more granular as far as those access scores. So we can come and maybe do another visualization where we can look at, the individual questions themselves. So what this allows us to do is we can go in and say we have multiple surveys going. Maybe we have a survey from a prominent survey company, but we're also utilizing CAPS because we have some MIPS payments that are coming in. So if we want to look at one or the other, we can filter on those, and then we can look at the particular areas of focus within each of these, whether it's access or timeliness of visit, whether it's the care team or the provider itself. And so if we're looking just at like clinical access, again, we can see and sort and understand where our low areas are, and we can see individual questions that may be leading into this. And you can see right away there are some issues contacting these providers by phone. And so that is probably something that needs to be addressed right there. Now, these visualizations you can see here, these are great as far as getting a quick view of what's going on. Sometimes we may even want to get a little bit lower than this, and we may want to get really into the nuts and bolts of our analytics. And so that's when we can go from the visualization directly into the cube, and it still gives us the ability to quickly apply filters and things like that. But now is where we can get into that slice and dice type functionality, where we can come in and we can look at these areas quickly, and we can look at individual providers, and we can apply some sorts where we can see who's doing well and has behavior that we can model, and who's maybe not doing so well. And we can come in and really, if we want to get even further down in a production environment, we can come in and we can actually drill down into the survey level detail and see that information as well. So the visualizations are great, but sometimes this nuts and bolts analysis is where we really get the information that we're kind of looking for.
Yeah, it's really interesting to me, Scott, to see all the different ways there is to interact with data. And we could even be taking this same data and visualize it so it's presented back to physicians or other end users as needed. And since our data is modeled, we could build physician dashboards like this that quickly highlight to a provider where they stand from a patient satisfaction standpoint. They can quickly see things like how their patients perceive how hard it is to schedule an appointment, or how likely someone is to recommend them as a physician, so they can adjust their behavior as needed and trend it over time.
Yeah, and things like this really are things that I appreciated when I was in management, because it's something that I can get a quick view of things that need my attention right away, so that I can spend my time actually fixing what's going wrong rather than trying to find out what's going wrong. And I want to get back a little bit to the discussion on patient access, because again, it is a big part of the patient experience. Like I said before, it's the first impression that patients have of our practice, and if they can't get in to see us, if they have a problem, being able to see someone quickly is really a big deal. Now, the Press-Ganey survey actually had some findings regarding patient access as well that I thought were interesting. The biggest one that stood out is that most patients actually would prefer to schedule online rather than over the phone, which that makes sense to me. I would prefer to be able to sit there and look just by myself and sync up my calendar rather than having to, take someone else's time to have to do stuff like that. But when they can't do that, it was interesting to see that difficulty contacting the office was identified as the #1 roadblock in selecting a provider. So if they found a provider they wanted, but they couldn't get in contact with the office over the phone, that was the one thing that kept them from that prevented them from selecting that provider and choosing their care there.
Mm-hmm. And many clients that use PDS are reporting on things like their call center statistics, doing dashboards like this. So with reports like this, we can get a better understanding of our overall call volumes and amount of calls answered versus abandoned. Even on the bottom of the screen, you could see we can even blend in patient satisfaction data with that call center data. So let's bring it to the next level, Scott, though, and take a look at what we can do when the phone system data is fully staged into our analytics.
Yeah, I think it's really great when we can get, this data, especially phone data, is actually pretty easy to stage. It's usually pretty structured or pretty well structured to be able to bring into something like this. And when you look at again, a visualization like this, it's really easy to notice trends quickly. We can see our volume of total calls. We can see right away what happened to those calls, what was answered, what was sent to voicemail, what was abandoned. And again, we can highlight the outliers that are out there, and we can really see what's going on. And you can see down like in the lower right, where we're looking at hold times and abandoned calls, we can see there's really a large outlier out there where they have high hold times, and it's really feeding into the number of abandoned calls that are coming in, or abandoned calls that they're seeing. And it really helps you to go in and say, is this a resource issue? Is this a training issue? That's something we can fix. And usually you can find, a lot of easy gains by just focusing efforts on the one or two outliers that are really easy to identify that way. I think with visualizations like this, if we really want to dig into patient access, I think there's a lot to be found with really trying to reconcile what the patients are saying they're seeing and what they're actually seeing as well. So when the PDS stages patient access data, you can see things like appointment statistics, where you can look at, arrived, canceled, no-shows. You can look at how long it's taking to get in on average. We also look at scheduling utilization and how well providers are utilizing their scheduled templates that are out there, who's above 100%, who's below 80%, things like that. And of course, we can look at third next available, which is something that a lot of people are interested in. And you can see, we can focus on providers that have high third next availables, and we can see if their scheduling utilization is really high as well. But I think one thing to look at when we're looking at patient satisfaction is I like to look at the low third next availables, because what that's showing us is our system is saying we can get patients in. But as you can see there, when we focused on the ones that have low third next availables, a lot of time it's still taken over 30 days to get in. So really, what's the disconnect between those two? Is it that we're not offering times that are convenient for the patient? Are we not in locations at the times that the patients want to see us? Things like that. So if the system's telling us one thing and our patients are telling us another through their satisfaction scores, being able to reconcile that data really has a whole lot of value.
Yeah, Scott, and taking it a step further, when you're measuring anything, it's really important to add context to reports by applying benchmarks that show our performance and compare it to various industry standards. So in this instance, we're looking across scheduling metrics such as percent of same-day appointments, number of appointments per day per physician, and even number of days until third next available appointment. And we're comparing all those metrics to industry best practices to better gauge our performance and look for areas we could potentially improve to, move to that industry standard.
Yeah, I know the context is really valuable. I know a lot of times, if I'm going to work with a client on a patient access type thing and they see their numbers for the first time and they're like, is that good or is that bad? And, the answer is always, it depends. But, I think being able to measure yourself both internally and externally is kind of a key to providing that context, and just seeing the constant improvement over time is where the value lies. Now, when we talk about patient access and patient satisfaction, I will say the easiest way organizations can really improve their satisfaction with their patients and improve their access is by being proactive with it themselves, particularly when they've got patients that have chronic conditions that they're managing. And so that continuity of care can really be something that drives a lot of satisfaction. I know it certainly does in my case, when the practice is reaching out to me and looking at, my well care and management of any chronic conditions that I may have.
Yeah, and Scott, to your point, it's especially important for our patients, with chronic conditions, to make sure we're seeing those patients. So, at PDS, our HCC revenue capture product allows you to, first and foremost, pull the visit data and then stage that data to understand, which patients have chronic conditions. And from there, we can roll it up into risk scores and start to identify, care gaps they might have or we might have. So, and analyze our patient populations to ensure those timely visits are happening for the necessary follow-up care. And this is what we're going to look at actually in our next analytical visualization. Scott, if you wouldn't mind talking to that.
Yeah, we call this the HCC revenue capture because initially it was designed to help reconcile payer data with what our actual scores are and make sure that we're working with our payers that way. But it's also really helpful in working with being proactive with our patients. We can really quickly identify our high risk and our moderate risk patients that are out there based upon the conditions that we're managing. We can look and see who is scheduled for an appointment, who's past due for an appointment. Are they planning on coming in, or is it something that we need to reach out to them? We can look not just at their, management of their care, but we can look at wellness care as well to make sure that we're capturing all of the conditions that they might have on an annual basis and making sure that that list is updated. And then we can obviously drill down at a provider level and see the number of suspects that possibly need to be scored in a given year that can really help both with the quality as well as really helping these patients, make them feel like we care about them as patients by reaching out to them.
Yeah, and I really like the right side of the screen there where, it shows us which patients are overdue so we know to reach out to them. Just the act of our practice reaching out improves the patient's perception of our practice by, showing that we, obviously care about their well-being.
Yeah, and, again, what we're trying to do with this and with everything involving being patient-focused is managing perception. Because the patients are telling us what they're experiencing when we get their surveys back or when we're getting direct feedback from them. We also have providers and management that have their own perceptions where they look and say, I know I can get patients in. I know I'm providing good quality of care. Why are my scores so low? And then, of course, we have what the analytics is telling us, which is what is the reality of the situation. And so really getting that balancing act out there is really kind of critical. And sometimes that involves us pulling data from a lot of different sources in order to balance these perspectives effectively.
Yeah, absolutely, Scott. That's so critical. So one of the tools that we have that helps blend data is PDS Dash. And Dash allows us to take data from multiple sources, blend it together to automate the production of highly visual dashboards. And in fact, many of the dashboards we've shown today were actually created through the PDS Dash toolset. Also, one thing I always like to highlight is, as part of PDS Dash, we actually provide customers with a library of sample dashboards and reports that are across multiple different content areas to make it, both quick and easy to, build and create new dashboards and reports for the organization.
Yeah, and I really like those sample dashboards as well because, a lot of times when we start working with a client for the first time, they have no idea where to start. And so we can help them. Again, a lot of times people think a dashboard has to be this really ugly, messy thing with a bunch of numbers that you have to spend a lot of time trying to figure out, is this good or bad, whatever. You can make your dashboards really very highly visual, and you can make them very quickly in order to do that. And as an executive, that's what I always prefer, is being able to quickly look at a number. This is where we are. Being able to look at trends, making sure they're going in the right direction. If we can add a benchmark or a target to make sure that the numbers are above what we would expect them to be. So again, I can spend my time fixing the problems that are wrong rather than trying to identify the problems that are wrong.
Yeah, absolutely, Scott. I really like that, the visual aspect of that dashboard as well. So Here's another example from our Dash library where we're focusing on physician productivity. And because of Dash, I can easily put metrics together like, RVUs, scheduling data, patient satisfaction data, and, even quality data to help physicians, better manage their performance while, of course, being mindful of, patient satisfaction because it's all on, one page and easy to analyze for me. So, yep. So shifting gears a bit here, another way we actually empower our clients to analyze and visualize data is through data staging and data modeling. At PDS, we're experts at modeling healthcare data, and when you can't just summarize metrics like we saw in the previous two examples, PDS can actually model data that needs to be restructured to be effective. So our clients actually have the flexibility to leverage any industry-leading analytics and visualization software such as Tableau, Click, Power BI, you name it, our clients are using it. And also, a big part of the reason we're able to have metrics work relationally is due to the way we model out our data. So we're using what are called star schemas, and those allow you to blend different data sets by having common dimensions across different areas. So as you can see, this structure allows us to join multiple data sets seamlessly. So organizations can really get a holistic view of their organization rather than having data siloed in all kinds of different areas.
Yeah, and this is really great stuff to have kind of under the hood, so that again the technical guys really like that stuff, but again I like it from an executive standpoint of being able to go in and have everything in one place like this. So for example, I can look at my physician productivity and say this is the most important thing to me right now as a COO or as a clinic manager. I need to understand that, but because I have everything staged the right way, I can look at, my RVU calculations. I could even do custom RVU calculations, based upon any sort of unlisted codes that we may be performing or based upon some sort of compensation plan that we may have. We can customize those calculations, but then we can blend that data in together with things that may be other key initiatives like coding patterns or looking at charge lags. We can also bring in scheduling data so that we can look and see, what's our schedule utilization percentage, and do we need to start looking at templates? But then again, factoring in patient satisfaction so that we're balancing that perspective of the patients in addition to the analytics showing us what's actually going on to make sure that if we're undertaking an initiative, is it working as far as what the patients are seeing, and are they satisfied with what we're doing from their standpoint as well?
Yeah, and you really can't manage what you can't measure. So, here's another example of our data modeling allowing us to create a visual at the executive level where we have patient satisfaction data blended with both revenue cycle data and scheduling data. This allows us to quickly and easily find challenges and opportunities for improvement in relation to the patient experience by quickly identifying where we're underperforming on certain metrics.
Yeah, and again, let's bring in that patient sat data. Let's blend that in and make sure that we're balancing their needs first, because like I said before, when you do it right, everything falls into place. And I always harken back, Nick, when I was working on that big initiative. It was interesting that the CEO of the organization at the time really told us, it doesn't really matter what the reports say. It doesn't really matter what we know, what we're doing. Regardless of what we think, patient care isn't excellent unless the patient thinks it is. And so that's why it's really best to understand, the robust analytics coming from all of our systems, but also balancing in, that patient satisfaction and patient survey results so that we understand, are we doing the right thing for them as well?
Yeah, and I feel like that quote really embodies, the viewpoint that every practice should really have is, how important the patient's perception really is. At this point, I want to thank everyone for attending and hope everyone has a wonderful day. Thank you so much.
Okay, thanks everyone. Bye.